When adults go to therapy, it typically involves a lot of talking as a way to process and understand what's going on. But what about kids and humans that need other ways to communicate? Play therapy uses toys, games, art, sand, and other tools for communicating and connecting instead of just talking. This approach can be just as effective for building trust, gaining insight, and creating change. Play is something that children naturally engage in, and it serves a vital role in their development. Play allows children to create an imaginary practice world. In this world, they can learn how to express themselves, explore boundaries, connect with others, work through problems, and test out new scenarios. The smaller world of play can give a child a sense of control and predictability that allows them to feel secure enough to work through difficult emotions and problems. Andre is 5. Andre's mom brings him to therapy because he's been hitting other children at daycare, and he wakes up in the middle of the night screaming. Andre's mom and stepdad have both set aside to gently talk with him about what is wrong, but either he doesn't answer or he just starts loudly singing, "Twinkle, twinkle, little star." During therapy, instead of trying to talk to him about the problem, the therapist enters into Andre's world of play. Let's say Andre loves to pretend that he's cooking, just like his mama. He takes a toy shovel and mixes together some plastic vegetables that he serves to a stuffed bunny, a dinosaur, and a little mouse. He does this 3 times. And the 4th time, the dinosaur doesn't get any food and starts roaring at the bunny and the mouse. The bunny runs away, but the little mouse is stuck while the dinosaur keeps roaring and stomping. The therapist will note this change in the cooking scene and work within the play scenario to help Andre process and communicate. She asks, what is the mouse feeling while the dinosaur roars? And what does the mouse want to do? Andre says the mouse feels bad and then shows it scurrying away under the couch. She then asks what could happen in the scene to make the mouse feel better. Andre then brings back the bunny, and the dinosaur, bunny, and mouse all hug. Through this scene, Andre is giving insight into his world, his emotions, and his desires, all without relying on words. The therapist is making Andre feel seen, important, and secure while he is expressing himself. Over time, Andre and his therapist can build up his emotional intelligence, his self-confidence, his problem-solving skills, his communication skills, and his creativity, all within the world of play. Play therapy has 2 main styles, directive and non-directive. Directive play therapy is when the therapist more directly influences the form and content of play. In this style, both the child and the therapist are making decisions within and about the world of play. In the non-directive style, the therapist follows the child's lead and primarily plays the role of observer. Play therapy is used to treat a wide array of behavioral and emotional symptoms in children. The approach is designed as a way of communicating and processing the world that sidesteps the need for words. Using play as the primary therapy tool, many different behavioral and emotional concerns can be addressed. In summary, play therapy allows children to express themselves and understand the world around them by using an imaginary world that gives them a sense of control, security, and predictability.